Good morning, everyone. We have a number of attendees just joining us. We will start in just a minute. Thank you. Good morning, everyone. I'm Walter Kraft, Vice President for Communications. Thank you for joining us this morning. Today's virtual town hall meeting will last for about 90 minutes. I will introduce President Jim Smith in just a minute. He will review the agenda with you, and we will begin our presentations. The virtual town hall, as I mentioned yesterday in our campus message, has a capacity of 500 attendees. We are recording this meeting so that we can post it on EMU today so that those who might be unable to join either due to capacity or just unable to join for other reasons can view it at a later date. We understand that many of you have questions. That's an important element of today's meeting, and that's a main primary reason for us to do this. At the conclusion of the presentations, we have set aside considerable time for questions and answers. You can submit a question via the Q&A tab at the bottom of the Zoom screen. It's there on your right. I see somebody has already submitted one. Questions will be answered following the presentations, so we'll wait to the end of all the presentations and to answer them at that time. If there are questions that are similar to one another, we'll try to group those together so we're not asking the same thing in different ways over and over again. So with that overview of our plan this morning, I now introduce President Jim Smith.
Good morning. Thank you, Walter. Good morning, everyone. Thank you for joining us this morning. The town hall today will be a discussion, a presentation, and a series of questions and answers, as Walter just said, regarding our return to campus and the updates surrounding that return to campus, as well as providing an overview of the financial picture as that return to campus is being realized. First, Provost Longworth and I will begin by discussing the pandemic response, the update and the planning. Then Dr. Michael Williams from the College of Health and Human Services will be giving us some preliminary recommendations from the public health group. And then our CFO, Mike Valdez, will begin and continue a discussion that we have begun around the budget and give us a full budget update as much as we can provide today. And Mike will give details on what we know and what we don't know with regard to budgetary planning. And then again, as Walter mentioned, we'll do questions and answers. The panelists will take the questions. Should they be directed specifically to one of us, Walter will tell us that. Otherwise, we'll determine the panelist that we think is the most skilled in giving that response to that given question. So let's begin with the first slide. That's the overview. Let's go to slide number 1, where we are, where we were, and now where we are. First, where we were in just 3 months, we've moved from winter semester to our classes being largely in person to entirely online. And I've said this repeatedly in our communications. I want to thank all of you, particularly from this group this morning, our faculty, who were able in really very short order to move those classes online and move them online successfully. We've shifted most of our employees to remote work. We still have a number of folks who have been coming to campus every day, particularly in our maintenance and our custodial area. We've moved students home, obviously, and we did housing and dining refunds. We had some students that had to stay longer than they anticipated for reasons of transport, but also our international students whose country were not accepting even their own citizens to come back, and we made accommodations for those students as well. Comprehensive and ongoing facility cleaning, as I mentioned, many of our custodial maintenance individuals have been working every day, and we are trying to create a baseline of absolute cleanliness so that we have that baseline for coming back, whether it be classrooms, offices, auditoriums, public spaces. That ongoing facility cleaning has been quite intense. Daily and now weekly, we've had updates to campus, mostly as of late, once to twice a week, and we hope you found those to be useful and informative. And then we've created a comprehensive website with updates that are going on in the various departments throughout campus. Next slide, please. So where we are today, the university is transitioning away from, and we have transitioned from, what we all called crisis response, and now we're moving towards planning for the future. What will the future look like? Where will we be, and how will we get there? Our planning goal has been pretty obvious, I hope, to all, that we want as many operations as possible to be held in person on campus for the fall, including classes, somewhat normalized work schedule, but keeping in mind, as I mentioned at the board meeting last Thursday, business will not be as usual. Next slide, please. So our planning principles are 5 in number, health and safety being our top priority. And as I said, Dr. Michael Williams will speak a bit about that in just a moment. We have to provide excellent service to our students, and I believe we've done that in the online format. I know a number of you have been doing virtual advising. We continue to provide service to our students. Admissions has been doing consistent telephoning to students and keeping that contact going forward. We have to provide excellent service to each other and obviously to the community as well. Many of the activities that would normally be happening on our campus have obviously shifted to Zoom, like the technology we're using today, so that community actions and activities can continue on. We can't predict the future. I certainly wish that we could, but instead we'll plan for various different scenarios, and I believe we're modeling scenarios that our colleagues around the country and around the state are modeling as well. Nationwide, there are more questions than there are answers. We're asking for and asking of ourselves continued patience. We wish that some of these answers were clear and abundant. They are not. Many of you have followed the governor's executive orders. Those changes in executive orders obviously change the answers to questions that we have been posing and that we've posed others on campus with regard to this planning and the planning principles. And then number 5, inclusive excellence will guide all of our divisions, all of our decisions, all of our units, all of our subunits. Next slide, please. So the planning process, returning to campus operations will be phased. We know we're in uncharted territory, and we know that we have to be very methodological and we have to be very cautious. We're going to use our existing processes wherever possible. We'll bring forward to the input bodies the requests and the information that we have done as recently as with Faculty Senate and opening up our research labs. When necessary, we'll create some ad hoc groups, and we've done that. And as I mentioned, we'll hear from the public health ad hoc group today, and we will listen to their recommendations and take those recommendations as part of our next step in each of the planning processes. Some of you know that we've been using GIS students under the direction of Dr. Shi to measure classroom spaces so that we know what distancing of floor plans will require. Dr. Shi's students are helping us design and decide upon what 6-foot distance is for student A to student B and student B to student C. We know that we have to know those configurations in order to be able to go forward with that next phase of deciding what classes will take place in what actual classrooms. Next slide, please. So in planning, what should we expect? We'll have a university guidebook that will have campus-wide standards. It will include things like distancing, face coverings, health screenings, and the like. We'll have individualized plans. We have created some templates and we'll be updating those for units across campus. Each division will decide the unit plans. There will not be a single unit plan for all of campus because obviously we all do different types of work in different environments and different settings, different office configurations. We'll have training for employees. Some of you have seen the videos that are related to our research lab return to work. We'll have similar videos and other training materials for employees as well. And for our next section, I believe Provost Longworth is going to take us through some examples of the goals and the principles and the processes for getting us from where we are now to where we'll be moving forward. Rhonda?
Thanks, President Smith. We thought it might be helpful to walk through at least a couple of the early examples of how we're applying these principles. I think it's important to note that the public health group is working on standards that will apply for reopening for fall, but they're also giving us advice on plans that need to be in place a little bit before that. The first example that I'll use is a research labs example. The governor issued an executive order in May that allowed the phased reopening of research and creative spaces on campus to faculty and to a limited number of graduate students. So at that point, our Associate Vice President for Graduate Studies and Research, Wade Tornquist, and a committee of individuals that he put together, including lab directors, faculty lab directors, department heads, and deans, worked on a plan to open research labs. They followed the executive orders as they evolved over the next couple of weeks. And last week, we issued a plan, a draft plan, and presented it for input from our faculty senate. They were given the plan and reviewed it for a week and provided feedback and discussion last week. It was an excellent discussion with questions and answers. And that plan involves labs being configured, meeting with our health and safety officers on campus to map out the spaces, to share cleaning protocols and cleaning equipment, to talk about physical distancing in the laboratories. And once those things were in place, a researcher could ask to be cleared to come to campus to work in their spaces. As many of you know, for faculty, research in their laboratories and creative spaces are really central to the work that we do on campus, and allowing them to get back to work when it's been paused almost 100% for almost 3 months now is really critical because of the contributions that it makes. So we're happy to have a plan in place and to have our first researchers returning to campus this week. The second example is a limited number, a pilot of Summer B, very small lab and studio classes. So each class had to be reviewed for an exception to be on campus, and the only exceptions we granted were for classes that the pedagogy, the content, the methodologies could not be recreated effectively online. And the class size had to be consistent with the guidelines presented in the governor's orders. So we did okay a very small number of lab and studio classes being held in person, and those are beginning over the next couple of weeks. We've consolidated the classroom usage into a few buildings. There will only be one class in a building at any given time of day. And there's a very rigorous set of requirements in place. Students and faculty aren't admitted into the buildings until they submit a health screening each day. They must agree to wear face coverings. there are cleaning protocols where each day, as after the students and faculty leave the classrooms are cleaned extensively, and the bathrooms that are accessible in the classroom areas are also cleaned every day. So you can see that there's an extensive amount of preparation there. There's also a training protocol for the instructors that they will be completing this week. It's consistent with the training protocol that the research laboratory faculty are following, and they will do that through our bridge training system on campus so that we can monitor that everybody completes it and is ready to be in the classroom. The third example is we have a committee working on a plan for the phased reopening of offices. Just a reminder to everybody, because we do get a good number of requests, that the state and the governor's order still require that any work, particularly office work, that can be done remotely needs to continue to be done remotely. And we're being quite careful about observing that. We will phase return to on-campus operations because as fall nears, there are some operations that do need to be done in person. Although again, we're only going to bring back to campus those that are absolutely necessary for our operations. So right now, that means that we'll continue to operate remotely in the office setting until at least the 3rd of August. So those of you who are looking for some sense of how to plan for this, that's the date that we would at least anticipate some phased operations returning in person. Although again, no one should plan to come back to campus until their supervisor indicates that that's the case. Each office, each unit's developing its own plan using a template that we'll distribute once we have the public health guidelines issued this week. And it needs to be consistent for the safe return to on-campus operations. So again, I think the overall picture is one where we're developing operational plans for fall. Anybody that needs a plan in the meantime works in conjunction with their union or their unit leader, and they work with the Public Health Committee and present that for consideration and approval. And where necessary, where it involves faculty work, we do submit it to Faculty Senate for input and get their feedback before we finalize any plans.
Thank you, Rhonda. The last slide for this section is just a stay informed slide. Many of you know this, that we'll continue our emailing. It is the official form of communication. We'll continue to have those email updates. As I mentioned, we're doing 1 or 2 a week now. I anticipate that will probably continue with that rate up until that date of August 3rd that Provost Longworth just spoke about. We also have the website that I mentioned earlier, hashtag coronavirus, typical intro, www.emish.edu /coronavirus. And then keep in touch with your department heads, keep in touch with your deans. I'm sure they'll be sharing information. I know Provost Longworth is meeting with the department head groups and the deans on a very regular schedule, and trying to give as much information to those individuals as well. So thank you for the first segment, and now it's my pleasure to turn over the electronic podium to Michael Williams, who is the director of the School of Nursing, and Dr. Williams' work most recently as a leader on our public health work group. So Michael, take it away. Thank you.
Thank you, President Smith. It's great to be here to share what the Public Health Work Group has done to date, and we do have a lot of information to share with you. The Public Health Work Group background is that we were an ad hoc group. We were asked to participate in the planning process, many of us based on our experience and our expertise with infectious diseases or disease processes and practice. We were charged with recommending campus-wide public health standards for this fall. And I will say we are asked to do that at a very high level. We many times we're getting down in the muck and dealing with operational issues that we had to continue to put aside since that will not be our charge. Our charge is really to say, this is what we recommend from a health perspective. I would like to echo what Provost Longworth said, that each department or each office will have to have its own plan. Likewise, one of the things I think many of us on the committee recognized very early on is that we could not anticipate all the different offices, departments, pedagogies that are being used. And so we were very open and welcome when people would ask us questions, because we simply didn't always know the answers. And it prompted us to look and find them out. Probably one of the best examples was athletics. It's very difficult to do football or wrestling or basketball from a 6-foot distance. So we had to really work with them and look at what the current literature and evidence is to base our recommendations on. The public health work group membership is made up of this group. Dr. Morelli Nair is the chair. You can see all the rest of the individuals that are involved here. They have all been invaluable for us to review the literature, but also based on their prior experience and expertise. I will say I have been so enjoyed working with this group, because everyone is excited about the work we're doing. Everyone has a passion for the work that we're doing. And each of them has spent many hours looking at the evidence to make our recommendations. So I will say to the public health work group member, thank you personally, but also thank you for allowing me to present the update to the group. Next slide. So one of the things we did early on is we did break up into subgroups to address the key topics. And I'll show you the 6 different areas we specifically looked at a future slide. We consulted with internal experts. So we talked to and have been talking with the public health faculty in the School of Health Sciences and School of HPHP. We have consulted external experts from the Washtenaw County Health Department. Many of us have been talking to colleagues at other institutions. I personally have monthly meetings with all the deans and directors of School of Nursing in the state of Michigan, so I could hear specifically what they were doing on their campuses as well, or what they didn't know what they were going to do yet, to help inform us. So we are really advising operations engaged in the first phase of safe return for those who started in Summer B, athletics who started, and other groups, but also constantly looking, and I have to reiterate this, that the guidelines have been changing quite frequently. And so while one day we will have our group meeting and say, this is what we're doing, a week later we'll get some update from public health or Michigan Department of Health and Human Services that will, change our guidelines a little bit. What I'm going to present you to do there today, though, however, is almost everything we've been consistent on through every week we've worked on this. Next slide. So we were specifically asked to look at these 6 areas: personal hygiene, personal protective equipment, physical distancing, facilities, screening and testing, and communication and training. And so again, we've took these pieces apart and looked at them very specifically to make our recommendations. So next slide. So personal hygiene was included, and I think for those of us who are on this work group, most of us being health professionals really take for granted personal hygiene and frequent and proper hand washing. And for those of us like myself, who is a nurse, we know that's not often the case. And in fact, the literature and the research that's been done for this on over 40 years by Dr. Elaine Larson at Columbia University has shown that even healthcare professionals don't wash their hands as frequently as they have. It's not so much whether it's the use of hand sanitizer, soap and water, or whatever special type of thing, it's whether or not you do it. So it's a behavior change, and that, as we know, behavior is hard to change. So it is frequent and proper hand washing with soap and water, a minimum of 20 seconds, making sure that you get the palms of your hand, the surface of your hands between your fingers, and also underneath your fingernails when you're washing your hands. So Most of us in the School of Nursing, most nurses and physicians of practice will tell you soap and water is better than hand sanitizer. Hand sanitizer is effective and will work, again, if it's used and if it's used properly. So it has to be used frequently. It has to be made readily available. That's the one thing, again, research has shown that even doctors and nurses will use hand sanitizer more frequently if it's put in convenient places for them to use, and they're given reminders and encouraged to wash their hands. We tell patients to ask us, have you washed your hands before you provided care to me? And that we should not take offense to that. Also, proper use of hand sanitizer means that you have sufficient volume of hand sanitizer. Most people's hands, one little squirt is insufficient. You want to saturate both sides of your hands, both hands, and you want to wipe it until it dries fully. We are going to provide access to hand sanitizers in buildings. We do want people to use cough etiquette, meaning that you cough either into the crux of your elbow or that you use a tissue. And if you use a tissue, that you properly dispose of that, and then you follow that also with hand washing. And you probably see people all the time who don't do this. We've also talked about providing student education in the residence halls, one, to encourage them for personal distancing, personal hygiene, proper disposal of tissues, and also just general cleanliness and disinfectant. And Dr. Mihalko reminded us at one of our meetings, and again, I think many of us in healthcare know this, there's a difference between cleaning and disinfecting. We are doing both. So we're cleaning surfaces and then we're disinfecting. So that's important to remember. And I think perhaps through all of these recommendations, we have said that signage to encourage people, so signage is in the bathroom, signage is in the public spaces, to encourage people to do this does help, and we will provide those signs as well. Next slide. Great. So face coverings are personal protective equipment. Face coverings are going to be required on all EMU grounds with very few exceptions. We would encourage you to wear your face covering from your car across campus to your office. So literally on all EMU grounds, not just inside of buildings. And mostly that's because it's very easy to come in contact with people within a 6-foot distance, or forget you have the face covering on or don't have the face covering on, and you run into a friend on the street walking to your building or a colleague. And so we're going to ask that you wear them from your car into the building. When you get screened in the building, if you don't have a face covering, we do have face coverings available for you at that point if you forget it or your face covering has been soiled or is dirty. We are going to ask instructors to use face coverings or lecture behind plexiglass to minimize, again, spread of the virus. We know it's about 4 to 6 feet. So 6 feet or greater is what we're recommending. So plexiglass will stop that. And so those are the two things we're doing. We did have discussions about those individuals who are hard of hearing, those individuals who have challenges projecting their voice, particularly for face coverings or lecturing behind plexiglass, that we are going to recommend or suggest that we have microphones or other visual aids. There are face masks that have transparent covers so you can see people's lips. But Andrea Sakraychuk, Dr. Sakraychuk, who's on our committee, wanted to remind us that most people do not actually that are hard of hearing, do not use lip reading as their primary method, and that those individuals should really seek out assistance from the Disability Resource Center. We will provide the face coverings if you don't have them. And one of the things that we were asked is what will happen if there's non-compliance. And obviously we're going to have to modify policies to address that, the Student Code of Conduct, HR, working with that. And again, if you have a medical condition that prevents you from wearing any face covering, you would need to talk to your doctor and get accommodations for that as well. The other question we were asked was, when do we stop this? When can we stop this? And I'm sure you've seen it in public where people have stopped because they're confident they don't have to wear them, but really we are encouraging everybody to wear them at this point. So until the university deems them no longer necessary or required by law. So the university could make the decision that we're going to extend the use of face coverings for a longer period of time than simply the law does. And same thing, extensive signage across campus, emails, websites to publicize the fact that we are requiring face coverings across campus. Another question we had early on was the use of gloves. And in general, wearing gloves is not recommended for protection against COVID-19. And in fact, one of the challenges is that most people who wear gloves assume they're protecting themselves and they cross-contaminate many times over. A colleague of mine actually counted her mom cross-contaminate herself going into a store and getting back in her car 10 times. So we really are not recommending it for routine protection against COVID-19. But specific work tasks may require it. So if you're someone who's working in facilities, or you have cleaning duties, or you're going to use bleach wipes, Clorox wipes, Virex wipes, any type of disinfectant or spray where you can wipe down a surface, most of those do require that you wear gloves to protect your skin. And we want intact skin versus skin that has been destroyed. So if you have a specific work task, we do ask that you wear them. Also, I'll mention here that there was a lot of information and disagreement about how long the virus stays on surfaces and stuff. The nice part is all of the cleansers or all of the disinfectants that we use does truly kill the virus. We don't know exactly how long it stays live on surfaces yet. The literature and the research is still being done on that. But one of the things is each of the different disinfectants you do use do have a dwell time, so that you wipe down, for instance, a counter with a bleach wipe, true bleach, sodium hypochlorite. You have to let it dry for 4 minutes before you then wipe it off again. So one thing I would tell you is that at the hospital, we see this all the time. Surfaces look like they're dirty, but it's actually the fact that they've been disinfected. So they're not dirty. They just kind of look kind of cloudy and hazy because of the disinfectant on the surface. So Virex requires a 3-minute dwell time before you wipe it off as well. So the longer you can let it sit, the better. One of the nice parts about the summer B sections is that facilities is going in and they're cleaning after each class, so that the dwell time is actually all the way until the next class period on the next day. So there's no issues of sufficient dwell time. And that if you do wear gloves for your job or for your purposes of disinfecting, that you must dispose of them properly. So next slide. We are going to recommend physical distancing of 6 feet or greater whenever possible, and again, until the university deems otherwise based on the research and science. As Dr. Longworth said, that they are looking at spaces in each classroom, deeming how many people would be able to be permitted to maintain that 6 feet distance. And again, I'm really glad that with 2.4 million square foot of campus buildings, I'm not the one having to do that, but I'm glad someone's doing it. Plexiglass shields may be needed in certain places or spaces for lectures. We are recommending to reconfigure, remove seats, furniture, workstations where needed. So in order to maintain physical distancing, you will most likely see in the men's room, urinals, every other urinal blocked off so that you cannot get that close to each other. You may see the same with stalls in the bathroom. You may see sinks in the bathrooms. So there's lots of different ways that you may see those happen. We are also recommending that any of the air hand dryers not be used. We do know that the blow dryers that you use to dry your hands actually circulate the virus. So those will be either taped off or disengaged so they can't be used, as a reminder that we want to minimize distribution. And that also goes in workplaces with fans and stuff, that we would really discourage the use of fans in any particular workspace that is open in particular, but to be mindful of people in cubicles next to you if you need to have a fan for your own comfort. Recommending signs, tapings, other visual cues, that we conduct meetings remotely, even when possible, even when we're on campus. So if there is really not a need to come together physically, that we even use Zoom meetings while we're on campus is another recommendation. Recommending, as most places, phased return of employees to campus, and I think Dr. Longworth talked about that, that we would potentially stagger people coming in, or some people might work Monday, Wednesday, Friday, other Tuesday, Thursdays. Some people may work, you know, kind of a day shift, an evening shift. So when we can be flexible and minimize the number of people at any one particular time, that would be our goal. And like I said earlier, each division college department will have to develop their own plan reflecting their workspace and type of work. One of the questions that came before us was vocal musicians, since we know that choirs actually spread the virus pretty readily. And so we, you know, have looked at that a little bit, but very minimal, but we're going to have recommendations from the Department of Music and Dance for how are we going to manage that, and what are their recommendations first, or what are their concerns, so that we can actually adequately and sufficiently advise them. And I will say in this regard, Dean Heller was very nice and sent me an article about West Point and how they're doing their vocal musicians with plexiglass and everything. So I cannot particularly imagine every particular department on campus and what their unique needs are. Neither can the committee. So we're actually looking forward to people sharing their concerns with us so that we can help provide guidance in that case. So we are recommending that we conduct some classes remotely. So particularly large classes that are going to be challenging to find campus locations where we can't do physical distancing. So in classrooms, if there's just simply too large of a class, or where physical distancing is not possible. So athletics is another great example where they had to create a very detailed plan of how to get athletes back to campus, and plans to reduce the risk of exposure from one person to another was very important. And I can tell you as well, our nursing students on campus actually perform physical exams and do skills on each other where they're touching each other. So we have a plan to address that specifically for those groups of students. And then again, remove seats, furniture where needed, or reconfigure, particularly for summer B in-person classes. Facilities is the piece that we dealt with most recently in the public health work group. And I think we ended up with 4 pages of recommendations, or 4 pages of detail that Scott Storer and Dieter Otto provided to us. Dr. Morelli-Nair worked with them to look at this. But if any of you have gone to campus, I've had to go twice now for 2 reasons. Definitely you can tell there has been enhanced cleaning protocols. And again, I would say cleaning and disinfecting protocols both. That we develop cleaning protocols for each office room based on type of use. Proper use of disinfectants, like I said, in terms of the dwell time so that they actually take effect is important. Modifications to ventilation systems can also occur, and so you will see physical plant changing out the number of cycles of fresh air into buildings to help dissipate any type of virus in the system, but you may see temperature and humidity levels changing in the buildings as a result of that. Unfortunately, it's a consequence of bringing in more summer hot air at the moment. So you will see that. They also are investigating, and we use kind of the most standard, most high standard HEPA filters or filters that you can use for ventilation systems. So we're doing the very best we can there. And I think that their plans are very extensive from what we can see. I will also say, knowing this as a nurse in a hospital, no hospital housekeeping system can keep up with the amount of facility cleaning that needs to occur. So nurses, myself, when we have downtime, we are picking up the Clorox wipes and washing down doorknobs and handles and counters and stuff. So I think that's important. We will also put cleaning protocols and supplies in most rooms or nearby. So if you want to disinfect the area that you're working at, you can do that. And we will also have to do training on this because, you know, these chemicals can be hazardous on their own. If used properly, they're very effective, but you do have to unfortunately know how to use them properly. Next slide. So screening and testing is very challenging right now. We are recommending daily self-screening of employees and students. We have looked at the literature. We have had discussions with the Washtenaw County Health Department, Dr. Marquez, and we have looked at the World Health Organization, the CDC, the Michigan Department of Health and Human Services, the American College of Health Association. We have looked at the American Industrial Hygiene Association. We have read and sent anything anyone has sent to us about all of this, but in particular related to screening and testing because there is so much controversy related to it. So we're going to recommend daily screening of employees and students. We are not recommending daily testing, and I'll get to that in a second. I kind of want to do screening and then I'll move to testing, but screening is pretty much the standard, and if you test positive for any of these, you will not be permitted to enter the building and will have to report either to your supervisor or faculty if you're a student. We are currently using a paper-based system, but we are exploring a web-based system. Eric Kirkland and Dr. Sherry Bumpus from the School of Nursing have been looking at these, and we've looked at Ford Motor Company, we've looked at Mass General, we've looked at a whole host of these that we are hoping will be the most efficient and effective. Many of these apps, if you've seen them, have a red-green designation. So if you turn green, you're given the clearance to enter any of the buildings on campus throughout the day. And they're date stamped, so you know the day the person has screened. If you get a red screen, we would suggest that you cannot enter the building. We are going to have designated building entrances. So there will typically be one entrance to each building that all students and all faculty and staff will enter through to be screened to promote compliance. We are recommending or considering that we wear EMU ID around campus, and mostly that's to identify visitors and vendors to campus and differentiate them from EMU staff or students. And we also have protocols for off-campus visitors. And the first thing is we would recommend if they don't need to come to campus, that we would encourage them not to come to campus during this period of time where we're using all these precautions. Next slide. So evidence would suggest testing is only needed for individuals with symptoms, but community confidence is higher with testing. And this is, again, very controversial. I don't think for most health professionals, however, but definitely for the public. There's this sense that if we test more individuals and we detect them and we isolate those individuals, then I'm at less risk if I am negative and I'm not sick, which is true to some extent. But the problem is these tests are only as good as the day you take the test. So if I have you take a test today and you screen negative and you're fine, there's no guarantee tomorrow that you're not going to be positive. So one of the best ways to do this is really only with symptoms. We are going to recommend that we do antigen testing using PCR with groups of higher risk of exposure. So student athletes were actually given baseline testing when they returned to campus. I have not talked to the department head in vocal performance, but that may be another group that we might want to test. We have talked about on-campus residents, so people who live in the dorms, and international students is another one. International students do have, by CDC guidelines and Homeland Security guidelines, a 14-day mandatory self-isolation once they arrive into the country anyway. So if they arrive and spend 14 days in self-isolation with no symptoms, the question is, do they still need to have a baseline testing? And that really has not been determined based on the evidence. So we are just looking at the evidence is suggesting that we do screening, but not necessarily routine testing. We do know that people can, be asymptomatic and test positive, and that we do then self-isolate them for a minimum of 10 days, maybe up to 14 days. We do need to do contact tracing to figure out who they have been exposed to. But I personally have taken care of patients that for 2 and 3 days in a row have tested negative. We've retested them, they've tested negative, they tested negative, and finally on the 4th day tested positive. So the tests are only as good as the day you take them. And so unless you're going to screen or test everybody every single day, which is impractical and very painful if you've had one of these done, it's not something we're recommending at this point. Next slide. Communication and training is something we have spent a little bit of time on, but we do need to amend and create policies for HR and the Student Code of Community Responsibility. We do need to have clear and easy signage, and we do need to have training as well. And this is, again, one where Dr. Nair and Walter Kraft from Marketing Communications have worked with the public health faculty in the schools of health sciences and HPHP to come up with the communication and training that they're recommending based on their expertise in health education and public health. Next slide. And at this point, I'm going to turn it back over to President Smith and look forward to your questions.
Thank you, Michael. That was very informative, and I've said this before, but please thank your colleagues that are working in the public health arena. It's been really a great amount of work on all of your parts, and I thank you for that. Many of us have been asking, and I want to make clear what we're doing as a part of the recommendations that Michael just shared. And obviously there are others that will be coming forth to the steering committee. The steering committee will review all of these recommendations. When finalized, obviously we'll review for final approval, and they'll go into the guidebook. I'm asking the steering committee for candid input around these, and we are also asking where we will move some of these sections for example, when we talk about seating in large auditoriums, when we have a final decision of covering versus disassembling the chairs, then we have to decide where is that work going to take place. And all of that will be between the steering committee and Provost Longworth and myself to get that information out to the next action team to take that action and move it forward. And items that require formal input, as I mentioned earlier, using the example that Rhonda gave us on the research lab, will obviously go to Faculty Senate for their approval. And obviously we look forward to that input, and any feedback that they would provide us will be considered as well. So it is a multi-step process, but I think it's one that we now understand. And again, with the information coming forward and the details that you can see from that information, it has been pretty clear to us what our next steps are. Next in our presentations, and before we go to questions and answers, is our CFO, Mike Valdez. And Mike, I'll turn the virtual podium over to you again.
Thank you, President Smith, and good morning, everyone. Thank you for being here. So when all of this started, the university is coming off reporting 2 consecutive years of break-even results. On March 1st of this year, fiscal year 20 was on track for a small surplus. We were substantially into the budget planning process for fiscal year 21, and we're nearly balanced already. And fall 20 applications were up nearly 20% compared to the prior year. Then, of course, everything changed. Next slide. So on the screen here, you're looking at our forecast for the year end for fiscal year 20. Year end for the university, for those who aren't aware, is June 30th. And this compares our budget to our forecasted results. This accounts for a number of expenses associated with the COVID-19 impact, lost revenue associated with discontinuing of operations in many of the auxiliary units, and a 20% reduction to state appropriations for fiscal year 20. Please keep in mind the state operates on a different fiscal year cycle than the university, our year end being 6/30 and the state's being 9/30. It's unusual for us to have this level of uncertainty as well, with only 8 days remaining in the fiscal year. We've assumed in this case that 20% reduction. We do not know what actual changes the state may implement, and it's uncertain to us at this point in time when we would know more. Next slide, please. So the university has taken a number of actions to accommodate for the financial impact associated with the pandemic. First, university leadership, as you know, took a 7% salary reduction effective May the 1st. Non-bargain staff will not receive a salary increase in fiscal year 21. And most staff have been moved to the 80% or 60% work-share program through July 2020. So work-share is actually a program run by the state of Michigan Office of Unemployment that enables folks to qualify on a pro rata basis for unemployment benefits while still working on a reduced schedule. This is particularly helpful in that it allows the university to realize cost savings. It minimizes the impact upon the affected staff and allows them to sort of continue to receive benefits. We've also suspended or delayed a number of capital projects that were planned. That's realized significant savings in our cash position, and all travel has been canceled. Next slide, please. We've also been working with individual divisions to immediately identify 10% savings. It's clear that if the worst case scenarios associated with state appropriations are realized, this would not be sufficient. And we recognize that there are certain areas that are particularly challenging for us from a budgetary perspective. I think instruction is a great example of that. As we look at operating in-person classes at lower capacity, it's difficult to realize efficiencies associated with your instruction delivery. Financial aid obviously is an important element around our recruitment for students. And during this time period, we don't want to de-emphasize our efforts around admissions and recruiting. I also want to take at this point in time the opportunity to thank the University Budget Council, which has been meeting over the summer and has provided a set of preliminary recommendations to the president. Next slide. So as we are planning for fiscal year 21, we're dealing with an unprecedented level of uncertainty due to COVID-19. State of Michigan budget, both for fiscal year 20 and fiscal year 21, is in flux. We've seen estimates as high as $8 billion in terms of lost revenue for the state across those 2 years. State of Michigan economy is experiencing a significant job loss with over 20% unemployment. And it's unclear exactly sort of how the student decision-making process is changed. It appears that they have sort of delayed that decision-making process, but what we don't know is really what kind of experience students are going to be looking for. The other uncertainty, and this has been particularly challenging as we moved along, is the difficulty to predict the phasing of any executive orders for late August return to campus. And as we saw earlier, we expect significant financial losses for fiscal year 20. Next slide. So when we look at our baseline assumptions for revenue for fiscal year 21, we're modeling 375,000 student credit hours at our current mix between graduate and undergraduate. In fiscal year 20, we budgeted for 400,000, and our forecast is to be a little over 411,000 for fiscal year 20. The board approved last week an undergraduate tuition increase of 2.9%, and we are fitting within the governor's recommendation for 4.25 for tuition restraint. Graduate tuition increased 4.9%, and in the budget that the Board of Regents approved last week, we have assumed flat state appropriations for fiscal year 20. We don't know the magnitude of the cut. We've been told to expect something anywhere from 10% to 30%. Obviously, that's a very large range for us, and those would have significantly different consequences for the financial performance of the university. And to sort of compound the uncertainty associated with that, we likely won't know until September at the earliest. Next slide, please. So this is a slide you're no doubt familiar with. It sort of tracks the history of student credit hours across academic years going back to fiscal year 04. For fiscal year 21, we're projecting a nearly 9% decrease year over year compared to our fiscal year 20 forecast. And you can see sort of we've had a very persistent decline in credit hours, primarily attributable to the demographic changes that have happened in the state. Next slide, please. So we talked a little bit earlier about state appropriations and perspectives around reductions associated with that due to the state budget issues. This gives you a little bit of history around state appropriations, which constitute around 25% of our total general fund revenue. You can see the last time the state made a similar reduction was back in fiscal year 12, where we were almost $12 million decrease in state appropriations. It's taken us almost the entire time period since then to recover. And across that time period, we've effectively lost $66 million in state support. Next slide, please. So when we look at our baseline expense assumptions, obviously personnel costs are the biggest component around the university's general fund expenses. We've looked at furloughing employees where possible. We talked about earlier sort of work share for nearly all staff through the end of July. That gives us the opportunity to reduce the uncertainty associated with our overall budget picture while receiving some savings, and at the same time minimizing the negative impact to staff. We've obviously assumed for all the contractual salary increases in our budget, the no annual salary increase for non-bargained for employees that we referenced earlier, and we modeled benefits at 40% of salary and wages. We have budgeted for a small increase in financial aid, but keep in mind this is on a much lower base in terms of the total headcount for students. So individual financial aid per student will go up. Next slide, please. So I think you certainly probably heard the message that our assumption around state appropriations is currently optimistic. The state budget timing is uncertain associated with that. We also have uncertainty around tuition restraint. This is also tied to the state budget timing. So if you watched the board meeting stream last week, you saw that the authorization was for the president to be able to adjust tuition to comply with the state's tuition restraint cap. We talked earlier about the impact of the state's significant revenue shortfall for fiscal years 20 and 21, the impact around student decision making. And it's difficult, when you listen to Dr. Williams and the recommendations associated with how we adapt our environment to living with COVID-19, it's difficult to quantify the expenses associated with it at this point. Next slide. So this is the general fund budget that the board approved last week. You can see the impact of the reduction in credit hours associated with our tuition revenue. When compared to our fiscal year 19 general fund budget, we're looking at a reduction of a little over $20 million in revenue. You can see essentially flat personnel costs, financial aid increasing, and then savings in the other categories. An important element around the overall university budget are the auxiliary funds, and there's a number of key risk factors associated with that. We are assuming a lower number of FDIACs this year than we have at any time in the past 6 years at least. We're currently modeling for 1,800 FDIACs, which has a very negative impact that you'll see in a moment around our housing and dining revenue. We've assumed a gradual return to normal operations. Many of these auxiliaries require groups of people in order to generate revenue. In that assumption, we also have to ask ourselves the question is what will be the behavioral changes for people around their interest in large gatherings. We have risk factors around any second wave. And again, expenses in this realm are also difficult to quantify for COVID-19. Next slide, please. So this gives you sort of the revenue picture associated with the auxiliary funds. I would highlight for you the significant reduction in housing, which is residence halls and apartments, and dining revenue as well. That's directly linked to the assumption around a reduced FDIAC population and the fact that last year's FDIAC population was relatively small, which is sort of the driver for returning students into our housing. Next slide, please. And with that significant reduction in revenue for the auxiliaries, you can see they've made significant reductions in their overall expenditure budget for next year. With that, I'll return it to President Smith.
I believe Walter is going to walk us through the questions and answers here, and I understand there are quite a few of them that come forward, Walter, so if you would like to identify maybe by grouping them, as you mentioned earlier, and then also if one is specifically directed to each or any individual panelist, let us know that and we'll reply.
Absolutely. Thank you very much, President Smith, and appreciate all the excellent questions that have been coming in throughout the presentations. And I'm just going to jump right in and we'll get to as many as we can. We had a number of questions, especially at the beginning, about the calendar, the academic calendar this year, noting that some universities are ending face-to-face instruction at Thanksgiving. Others are delaying the start of the winter semester to after MLK Day to allow faculty more time to make necessary adjustments for the winter semester, and concern about only 2 weeks between the fall and winter semester. I think this question is best for Provost Longworth. Provost Longworth.
Thanks, Walter. I think that I'm going to delay answering on the winter semester because in thinking through these questions, just to give people an idea, there's more time between now and the beginning of our winter semester than there is between when we had the first case of this virus in Michigan and today. The situation is evolving very quickly, and right now, the people modifying their calendar are doing that based on student populations and a pattern of attendance that doesn't really match ours very well. So I think we need to evaluate changing the calendar pretty carefully. So winter, I'm not really necessarily prepared to do that, and we've had there's an issue with not having a break in the middle of the semester in terms of student mental health and physical health as well, and so I'd want to have that conversation pretty carefully. For fall semester, we did look at making a broad campus decision to change the calendar and decided not to move forward with that after talking it through. There's a couple of reasons for that, primarily because to do that would mean students in the residence halls who really we found in large numbers that's their permanent home, and they don't leave to the large degree that maybe some other campuses do. And so they wouldn't be leaving campus in the same way. And almost 80% of our students come from the 7 counties contiguous to campus. So the idea that they're spreading out widely at Thanksgiving and then returning is a pattern that we just don't see on campus. So some of the logic for residential campuses, or some of the campuses up north in Michigan, for instance, we don't see that same pattern of student campus behavior. So we didn't want to make a campus decision to do that because it's not supportive of students. But one thing I have encouraged in the unit planning process is to think about it from a campus perspective of minimizing population density on campus and other things. There are pedagogical designs that departments can look at in the offering of their courses that might incorporate either that kind of a calendar where you have a semester that you have a term that's already available and has always been available in fall that lasts 7.5 weeks, 8 weeks, 10 weeks, and 12 weeks. And so you could schedule a course that had its meetings modified in that way. Or you could schedule a course in hybrid format that the meetings were scheduled in the fashion that we're talking about. But I think those decisions need to be made consistent with the content of a course, the methodology of a course, and support the educational outcomes of a course in alignment with the health outcomes that we're talking about here. So we aren't going to make a campus decision to modify the fall calendar for all operations. But as we go through the unit planning process, I've communicated to deans, and as that process unfolds over the next 2 to 3 weeks, once we have the public health recommendations finalized, we'll look at the schedule, and they'll have some flexibility in scheduling that way.
Thank you, Provost Longworth. We have several questions about faculty involvement in the planning process. I think this is best for President Smith. Can you discuss faculty involvement in the planning process, whether it's in steering committee, the public health work group, some of the other planning that's underway, and provide some response to that?
Certainly. Thank you, Walter. On the steering committee, we have 2 members of the faculty that are designated for their knowledge base, for their experience to help guide us. The public health group, between faculty and those who hold faculty rank, the vast majority of that group is either holding faculty rank or a member of the faculty as a teaching faculty member. We do have a return to work group that is looking at some of our online configuration. We have faculty representation there as well. Each of the ad hoc groups, I've insisted on 1 or more faculty members. And then I know in the public health area, they have broken into subgroups where they've asked specific faculty who are not on the main public health committee to join them in a subgroup because their specialty is held within that subgrouping. So faculty are certainly represented. In some cases, the majority of those groups are faculty as well. So we've tried to include faculty voice on all the ad hoc groups. Of course, the input groups like EFC, Faculty Senate, those are all faculty members, or the majority are faculty members. Faculty Senate's all faculty. So as we went with the research lab protocols to the Faculty Senate, although Wade Tornquist is a faculty member, is serving in administrative capacity, he presented that information along with Provost Longworth to the entire Faculty Senate.
So, Walter, I'd add that with regard to a couple of upcoming groups, we're waiting. Senate's working on some appointments for groups that I've asked for that look like they're referenced in the questions. I asked for volunteers to work on a committee to expand guidance on the public health area for students and faculty staff members who have disabilities or needs for modification. And I'm getting ready to issue those invitations today. I have asked for input about or appointments to a committee to work on the conduct code and updating the conduct code. Although the conduct code already does contain language about enforcement, I think we need to clarify it and make it clear. So I've asked for some appointments there. And we're using the Standing Academic Issues Committee of the Senate to give us guidance about scheduling priorities for on-campus or online courses in the fall. So there are some additional groups coming online, particularly around instructional issues that I'm getting appointments for or information in addition to that.
Rhonda, that reminds me, I should have added that the steering committee has a faculty senate appointee, obviously a faculty member. So of the two individuals I mentioned, one is an appointee from the faculty senate. And thank you. By your question, you reminded me that I left that out.
And as I understand it, on Thursday, you agreed with adding perhaps one more additional faculty member as well.
We've certainly made that offer, yes.
Okay, thank you. And Provost Longworth, I think you partially answered some of our other questions. A number of questions about from faculty members asking about how do we handle the inside classroom operation. For example, requiring students to wear a mask and using hand sanitizer upon entering the classroom. A number of questions about that, and obviously that's a great concern. Provost Longworth, I think it's probably another one for you to follow up on.
Okay, so some of the protocols for enforcement are still being developed, but the goal is to have those go out and suggestions to faculty about should anyone be difficult or refuse to follow that, to how to use some of the processes that we have on campus to assist with anybody not being willing to follow what we have in place. For Summer B right now, we're going to use DPS. That's not an option for fall because that's they don't have the capacity to deal with enforcement challenges. But what we're trying to do, first of all, is start from an educational vantage point. And I think that if you look at businesses and other things that have come online, the ones that have been more successful with compliance with health standards and hygiene standards, what they do is they limit entry into facilities. They don't wait to enforce these things until people are in the buildings. So we're working on having people at doors to hand out masks if somebody doesn't have a face covering, to have Michael mentioned, the key placement of communications and signage and things like hand sanitizer as well. So trying to be proactive in educating people before they come to campus and letting them know that this is a condition of being on campus, is that you comply with these directives. Then we'll send some direction for how to work through difficult situations where someone decides to not be willing to follow the guidance that we issue. We're going to have conduct code enforcement around that, and people will not be able to stay on campus if they don't comply. So we'll have both in the moment advice for faculty that we'll send out with syllabus information, and we'll have a conduct process that supports the need to have these things in place and enforcing them. So we're going to have faculty involved in that conduct code update and try to work through the syllabus language here over the next couple of weeks so that people have it as they're preparing their syllabi for fall.
Thank you. A question here about testing. So Michael Williams, I think this is probably for you. And the question is, why are we not requiring tests or recommending them for Summer B students that are starting today? And why are we not doing that to ensure a baseline for public health?
Well, again, the evidence would suggest to us that that's not needed, and all of the students that are getting into classrooms today or this week are being screened with, I think there's 8 questions, I can't remember, we've added a couple, to see if they have any symptoms. So if the symptom screening is clear, there's really no need for testing. And like I said, the problem is they could test negative even this morning, and by the time they run their errands and run to Meyer, they could test positive by the evening. So it really is a shot in the dark for that. So it would be the high-risk groups that, you know, the Volca music, the international students, the dorm students, the athletes, the musicians in the band and stuff that we would be most concerned about spreading.
Thank you very much. A number of questions about the process for faculty to teach online versus face-to-face, and what the administration's thinking is in regard to that, and how those decisions are made, and how faculty, if they wish to move their class to an online class, might be able to suggest that. So I believe that would be best for the provost again.
Okay, thanks, Walter. We have a couple processes underway that I think will help us answer those questions most effectively. The first is if a person has an underlying health condition that for whatever reason right now makes them particularly vulnerable to COVID-19, then they should go through the request for accommodations process that is available in HR, and that there's guidance for how to do that and what documentation to submit and how to make that request. I know some folks have some concerns about that process, but I believe that's the correct process, and it is now one where you talk about what modifications are necessary, how that can work, and that's the process that people should use if they have a health condition that's aggravated or needs an accommodation. And so those folks, I would refer to that process, and they can do that whenever they're ready to begin that process there. The second is that we are in the process of measuring campus, as Michael indicated, and the president as well, and using GIS to map out the classrooms. My best estimate, based on what we're reading in the literature about this, and our GIS professionals right now on campus, what they're telling us based on the way our rooms are configured and seating, a number of other factors, we're looking at anywhere, conservative estimates say 12% of space will be available. More, I think once we add additional spaces, larger spaces, things that we've used for other purposes that we can make into classrooms, we're looking at maybe 35% of our capacity in person is what we'll have available in person. So we're already looking at a significant percentage of classes needing to be remote, online, hybrid, some combination of spaces so that we use space more efficiently. So until we have the space assessments of what can be on campus, it's difficult to give a precise number about mix. I'm expecting to have that information and reliable estimates of space by the end of the month. And then we can take a look at priorities that I've requested from academic issues in the faculty senate about how to assign in-person classes, what classes need to be in person to be most effective on campus. Once we match those things up, then I think we can have departments go through a process of assigning spaces and having those conversations about pedagogically what courses need to be in person, which ones are better taught remotely in mix. So I think that I can't make a promise that every single instructor can request to teach all of their classes online and that we can grant that on its face. I think the goal will be, however, to balance what faculty think can be taken online effectively, what students are asking for, and we decide is best taught in person, and then come together around those needs and work out cooperative solutions to that. I think most people will be able to have the format that they want, but I can't automatically promise each individual that without knowing what space I have available and what curricular recommendations faculty have around the courses.
Thank you. And sort of a follow-up or related question for you, Provost Longworth. Talk about, if you could describe a little bit, we've had questions about the planning process for the fall semester, or for summer B, I should say, and the scheduling of face-to-face classes, summer B, as sort of a, I think it was described in the question as a test run for fall.
Yeah.
Is this appropriate, the individual asks?
Well, I'll take a step back and say that the way that the summer B pilot came about was that there were a group of faculty that indicated that they didn't think their classes could be effectively or as effectively taught in a remote format as they could in person. So what I agreed to was to allow a few exceptions to the order to do summer remotely. And so there's a very small number, and what I have described as an opportunity to make sure that if we do these sections this way to help students graduate, to get different courses taught that in the curriculum, for whatever reason, are more effective taught in person, that we use that opportunity to really test our protocols and make sure that we have protocols that are effective. What we're doing is following the governor's executive order that's currently in operation as a checklist. It requires face coverings. We have face coverings. It requires training for employees. We have training for employees. It requires physical distancing. We have physical distancing. It requires hygiene protocols. We have hygiene protocols. We're really working down item by item, and we'll publish that within 2 weeks of when the semester begins. And we've worked through that. We've sent letters to every faculty member and worked with the faculty members on any questions. We've sent letters to all of the students. We'll make any modifications if anybody gets uncomfortable, but these were mutually agreed upon courses. No one was forced to teach, and I wouldn't have yet forced anyone to come to campus until we finished this process. So, and if anyone who's teaching in summer B decides that they'd like to wait until all of the fall planning is complete, we can move their course to a remote format as well. I think this was an attempt to try to balance some instructional needs that were expressed with safety, and put safety protocols in place that the governor required to assure that everyone's working in an environment that is safe. And I think that we've arrived at a very safe environment for those folks. And it will give us a chance to make sure that we have all of our protocols in a workable place for fall.
Thank you very much. A question about cleaning supplies. How do departments secure cleaning supplies for use in common space areas that may not be typically cleaned by the physical plant on a regular basis? I'm not sure who on our call here is best for that. So President Smith, I'll start with you.
Walter, I don't know that I have the exact nature of what the cleaning materials are, but I know Michael is involved, Dr. Williams is involved with Dieter Auto and Scott's store. So I might shift that over to him, but I would say a couple things that may be tangential to this question, but are important. We have had folks cleaning and using an iodizing machine that's actually iodizes Clorox. And they've been going through every room in every building. We've wiped down every desk. We've wiped down every doorknob. Some of you may know we have to fill out a return to work form if we have to go in. For example, I need to be in the office on Friday. I'll fill that out, explain that I don't have symptoms 1, 2, 3, and 4. I believe it's 4 parts. And then Dieter would be knowledgeable of the fact that I am in the office, the president's office, on that given day. And he will actually go back in and clean after I have left, either at the end of that day, over the weekend, or on the Monday following. So it has been very prescribed how the cleaning has been done. As I said, the maintenance and custodial crew have been working literally since that March date where we moved the operations of the university vastly online. They have been coming in with their own screening protocols and the like to get us to that baseline and to maintain that baseline. Michael, you may know more about the actual products and the usability and the functionality of those products than I do.
Yeah, I would just say that we have had discussions with Scott Storr and with Dieter Otto. The specifics of how that will happen, I don't know. I know in our college in March, in February, it was actually through the dean's office in our case, in the College of Health and Human Services. But we will have to suggest that plans be made for that.
Yeah. So I'll answer for right now with the labs and the Summer B that the plant is working with the safety office, Catherine Wilhoff's office, to provide those to people. So when they go through and walk through their lab spaces and the classroom spaces, they provide some cleaning supplies then. Right now, then every day, the cleaning crews go in and clean after the people are in the building, as President Smith indicates, so that it's clean before the next day and people arrive back. They're still working through how where the locations will be. That's part of the GIS process as well, is where all of the supplies will be located, because right now there aren't necessarily supply closets on every floor of every building, and so working out where those spaces will be. Do we have to take a room offline to make those things available? Where are they, and how will they be used? As we're looking at the fall schedule, we're also looking at building in hours in between, maybe scheduling every other hour, so that there's an opportunity to clean in between the classes. So we're working on the protocols, but they are, physical plant will have the cleaning supplies and work through that. To order them, if you feel like you have needs to talk about ordering them, that's purchasing. So there may be some departmental needs we're not aware of that are specific to a department. And if that's the case, then if you have cleaning needs that are specific to a laboratory or a particular discipline, then that would be something you talk to purchasing about. But the general cleaning supplies will be provided, and physical plant will set up a place for those to be available.
Thank you, Provost Longworth. A couple of questions, very practical, related to the classroom. Will face coverings be required, which the faculty member that wrote this fully supports? Is it safe to assume that professors may be able to remove their coverings when they're at least 6 feet apart from students in order to conduct their lecture? That's one question. And then the second, will faculty be required to wipe down their classrooms?
I'll take part of that, but then I think Michael should take the other part. Face coverings are going to be required. The only exceptions, and I mentioned this, may be cases of disability, and in what those accommodations will be is something that'll be worked out in conjunction with instructors. And if it's a student who has the disability that limits that, then that would be the DRC. If it's an employee, that's HR. And I'm not sure what those modifications will be yet. They're always negotiated depending on the setting. So face coverings will be required. I just think that's a given. I'll let Michael talk about taking them off under what conditions.
Again, we were recommending that they be worn all the time, and for any speaking. So the reality is we recommend 6 feet or greater, but it can be, depending on how vocal you are, how loud you are, it's kind of like the choir issue, that it can be spread in a great amount. So we would strongly recommend that you have the face mask on at all times while you're lecturing. And again, you may need a microphone, you may need some other mechanism, or also lecture behind a plexiglass. I did see one other question related to this, and I should have clarified, I apologize, but someone said, are face mask and face shields, what is the difference? Actually, face shields are to protect you. So we're not recommending really face shields for anybody in particular. And again, I will tell you, my students in School of Nursing will be using them because they're going to be within inches from the other person. So, but face shields are really to protect you, not to protect the people that you're projecting out into a lecture hall. So face shields and face masks or face coverings are not interchangeable, just for clarification.
And Walter, I would add the piece on faculty wiping down their desk surfaces or the desk surfaces in their classroom. That will not be required. We'll have ample time between classes to have those wipe downs done. Some of us, just for precaution, may want to re-wipe down the area where we lay our lecture notes or where we lay our laptop, just because we want to be extra cautious. But we'll not have faculty wiping down desk surfaces. And again, probably our own surface would be our desirability, our personal desirability, but not a requirement. We'll be working with Dieter and his team to make sure that we can have those classes with ample time between, as Provost Longworth mentioned, to have cleaning done before the next group is in there.
Thank you very much. We are over our time, but we do have a couple more questions I'd like to get in before we wrap up. So 2 more questions. As there are 2 sides to our budget, expenses and revenues, can we expect instruction to be held harmless in any cuts moving forward? If there are cuts from the state, it would make sense to grow, not cut, our main source of revenue. I believe that'd be best for President Smith and our CFO, Michael Valdez.
Well, Mike, I'll start and say that that's been our planning process for the 4 years that I've been here, is to try to keep our instructional budget as robust as possible, to not look at the way we earn income. And it's not quite that simple, but I think we all know that we have a very tuition dependent budget, and that should we massively cut instruction, that tuition dependency would be reduced because of the reduced amount of tuition coming into the door. I can't say that there won't be any instructional cuts. Mike has been very clear with his presentation today that the number that we're hearing out of Lansing is between 10 and 30. I spoke to Senator Wayne Schmidt a few weeks ago, and some of you know Wayne's actively involved in K-12 budgeting. Wayne has publicly said he's seeing for K-12 25%. I'd be very surprised not to see, I would be very surprised if we saw higher education held at a lower percentage than K-12. It just typically does not happen. So the answer is yes, we do keep that as front and center as we design budgets and as we execute budgets. But to say that it would be totally held harmless, I think we can't say that now, just because of the ill-defined nature of what the 10 to 30% might be, and whether we do have clawback to FY20, or do we establish only a 10 to 30% range, whatever that might be. Let's say we land on 20 for just FY21. Again, those variables are not clear to us. Mike, anything you would add there?
You know, I would just add 2 other points, President Smith. I think you summarized it very well. The first is we have, as you said, we always sort of prioritize instruction in our budget development. And we're working very closely with the Provost's office around what that'll eventually look like for us this year. That that development is challenged this year dramatically by the limitations around classroom size. And those configurational issues make it very challenging for the provost's office to sort of be able, at this point in time, to really have a great handle around what that instructional needs will be. So we're building flexibility and running scenarios in order to adapt to any one of these possibilities.
Mike, I probably should have said in my portion here too, that if you look at what we've done with work shares, for example, the various groups that are on work shares, there's an 80% and a 60% work share. We have looked at where we can get the maximum efficiency out of those working with 1 day off versus those working with 2 days off each given week within that work share configuration. And I'll just select athletics, where the vast majority of the coaches are on 2-day work share off, which would mean they're in the 40% category, working 60, off 40. And that, I think, is a demonstration of where we've tried to maintain as much savings, or to absorb as much savings from areas other than instruction, where we've seen, obviously, instructional support. We've seen that work shares, but we haven't seen that configuration play out for generalized instruction.
So the last thing I'd add is that this summer, for instance, we invested more, and the revenue, there's a revenue impact for that. And so I think we've been able to work together to find ways to invest, to grow revenue when possible, and to balance that with the credit hour reductions that are coming and that we're seeing going into fall. But we'll adjust the instructional budget to grow if there's full courses, and we did that for summer, and we'll continue to do that for fall. But realize that the magnitude of the budget cuts probably doesn't allow us to leave anything off the table right now entirely. We have to look for savings wherever we can, because the university runs pretty lean. So I don't feel comfortable saying that we can leave anything 100% off the table, but instruction is always a priority to protect.
Thank you. And we do have a final question. Again, as we talk about planning for fall, and the various work underway, we mentioned that a guidebook would be developed prior to our start this fall. Do we have any sense of the timing of that? And I don't know who that question is best directed to.
Well, I'll take a first stab, Walter. I would say the unit plans are critical to that guidebook. So as those unit plans are developed, and the quickness around which we can get those unit plans developed certainly will be critical to the guidebook. As we saw in the presentation today, Dr. Williams, Dr. Morale-Nair, and others in the public health group have been really working at breakneck speed to get their recommendations into that guidebook. So it's a bit ill-defined, because the unit planning will be a critical part of that going forward.
Okay, thank you very much. We have generally captured questions in general categories here, I think, pretty effectively. We know there are others that we haven't got to specifically. We are taking these down, and we do plan on responding to them after the fact. We realize not everybody had their specific question answered, but again, we try to group them into categories where we think we are addressing kind of the broader range of issues. So I thank everyone for their questions. This will be posted, as I mentioned, after the fact, and we will go through these questions and try to get back to you individually with specific responses. So thank you again.
Thanks,
President
everyone.
Smith.
I just want to thank everyone for being here. I think the number's in the mid 200s for those attending this morning. I just want to thank you for taking the time, spending an hour and a half or so with us. And I hope we've answered as many of your questions as possible. And certainly want to reiterate what Walter said, that we'll have a written response to those that we couldn't get to during this time period. I realize some of you have other appointments and things going on, and we're 10 minutes over, but I hope these extra 10 minutes were helpful. And I thank you for your questions and look forward to continued dialogue. Thanks for being here.